You know, as a parent, we want our kids to be successful, we want them to be safe, we want them to be healthy. So if your kid is experimenting with drugs and alcohol, that is clearly hurting their health. So what do we do if we suspect our kids are using drugs or alcohol? Joining us now with some strategies for dealing with this and keeping our kids safe, Dr. Sasha Waring. He's a psychiatrist, Swedish Behavioral Health. Good morning, and thanks for joining us this morning.
Thanks for having me.
So how common a problem is this, kids, getting into drugs and alcohol? I mean, kids experiment, we know that.
Mm-hmm. Well, it varies some state by state. There's different data based on the last 50 plus years of substance use rates, a couple national surveys over different states. What we do know is that non-marijuana use, so use of alcohol and other drugs other than marijuana, has been on a somewhat steady decline over the last 10 to 15 years among adolescents, but the rates are still fairly significant. For instance, over half of high school 12th graders nationwide have reported using alcohol in the last year, and something like 15 to 20% have said they've used alcohol in the last month.
Okay.
So alcohol and marijuana are the most common drugs used by teenagers that are recreational or illicit drugs at that age. And then other drugs are less common, but there's still certainly use of cocaine and other stimulants, and sometimes opiates and other painkiller medications.
Okay, so what's the average age typically that a kid would start experimenting?
Sure. I think any age is possible. I'm shocked sometimes at how early kids might experiment or get into some kind of initial use. We do know that early use is a major risk factor for developing a more serious substance use disorder, for not finishing school, for getting into legal trouble, and for other psychiatric illness. So I would say as a parent, if you're concerned that your kid might be using drugs, it's definitely the time to be asking about it, if not before you develop those concerns.
How would we know, though?
Yeah. So like with many mental health concerns and substance use concerns, there are a lot of non-specific factors that we might consider about looking at like how your kid's doing in school compared to previous years, who they're hanging out with, how much they're opening up and talking with you about stuff. If kids are being more secretive, if their performance in school is dropping off, if they're no longer interested in other activities, that might clue you into something going on, and on the list of some things is certainly drug and alcohol use.
Okay, what would be the best way to approach my kid? If I suspect, I mean, do I go and raid their room? I mean, what are the boundaries there, and what are the strategies that we can use to get to the bottom of this?
Well, in most situations, I wouldn't start with the room raiding and the urine drug tests. That might be coming on a little bit strong. There may be scenarios in which those kind of more severe interventions are appropriate. But when you have a level of concern and you're not sure what's going on, it would be dependent on your relationship with your kid, with your teenager or preteen, setting the groundwork early. So if your kid is younger in the preteen years, it'd be good to talk with them about drugs and alcohol, make sure that you have an open door policy where they're allowed to share with you stuff that's going on with their friends, stuff that's happening around them without fear of punishment just based on them telling you things. And you're really encouraging them or reinforcing kind of your desired behaviors, which is they talk to you openly about what's going on, rather than rushing immediately to punish them for doing something. So one thing that might not be as helpful is telling your kid, if you ever find out they're using drugs or alcohol, that all hell will break loose and you'll never forgive them, because that's a setup for them not really wanting to share anything with you ever.
Understood. What if you get into the conversation and they say, did you do drugs when you were a kid? And if you did, what's the answer?
So that's a tough one. I think it really depends on, there's not one right answer. It probably depends on the age. Some factors to consider would be the age of your kid. So for older teens, you might be more comfortable sharing such things about your experience. For younger teens, you don't want to send the message that you did it, so therefore it's okay. But older teenagers are generally more mature and able to understand that you may have made mistakes in the past that you wouldn't recommend that they go through. But some parents are more willing to be and wanting to be open about those kinds of experiences than others. I would just use caution and make sure not to glorify anything you may have done in the past that you don't want them to do.
It's great stuff. Dr. Sasha Waring, thanks for your time.
Sure.
Appreciate it.